Hello, hello, hello. Good morning, good afternoon, everyone. I know some of you might be joining us on the East Coast, on the West Coast, or in the Central Time Zone, or maybe even Pacific. So, hey, so wherever you are, we're glad that you're joining us this morning, and you're going to spend some time with Reach Talk. I'm very excited about our conversation this morning. We have some exciting guests who are doing some wonderful work here in the city of Buffalo, as well as Erie County. And I'm very just motivated and amped this one because these are some of my closest friends, I like to say, and people who I enjoy working with. But before we get into our conversation, just real quickly, for those of you who might be joining us for the first time, welcome to Reach Talk. REACH stands for Racial and Ethnic Approaches Towards Community Health. We're working hard here in the city of Buffalo to improve the health conditions of communities of color, specifically the African American Latinx community residents who, believe it or not, are some of the hardest hit and communities that have some of the greatest needs when we're talking about health and inequity. So we're really taking a strength-based approach and a collaborative approach in terms of engaging the community as a part of the solution. All right. So, hey, Samantha, how you doing?
I'm doing really good. Thanks for having bringing everyone together today, Stan. I'm also really looking forward to today's conversation. For, again, people who might be joining us for the first time, I'm Sam. I am a community healthcare advocate with the Healthcare Education Project, which is part of the Labor Union 1199 SEIU. So thank you for, again, putting this all together, and I am looking forward to talking with everyone today.
Absolutely. Thank you, Sam. And, our other co-host, she couldn't be with us this morning. She's out handling some other logistics for us. Ebony White, who needs no introduction. So we're giving a shout out to you, Ebony, as well. So let's just jump right to it. Let's get into the conversation. We have some guests that I mentioned to y'all that I'm very, very excited to have a conversation with. But if we could just briefly do an introduction. Let's start with ladies first. I was raised correctly. So Annette, you want to say hello to our audience, our people, our folks?
Yes, hello, and thank you for taking the time out to join us.
Thank you, my friend. And the Honorable Legislator Howard Johnson is with us, y'all, this morning. Good morning.
Good morning, and I'd like to say good morning to those who are viewing, watching with us, listening with us. Good morning. I'm excited about today's conversation.
All right. Thank you both. Welcome. All right, go ahead, Sam. I'm going to turn it over to you, my friend.
All right. And like you said, ladies first. So Miss Annette and I are going to start our conversation off. One of my favorite community leaders out here, Miss Annette, she is pretty much able to join you at the drop of a hat to make sure that things get out to the community when they're needed. Her and I, we spent some time out there in the dark passing out food downtown once or twice. And she came out because I told her I was ready to do it. And she's like, I'll be right there. So with that said, she's one of my absolute favorite community leaders. So flowers to Miss Annette. And why don't you go ahead and tell us a little bit about what it is that you do with REACH?
Basically with REACH, it's something that's near and dear to my heart in regards to educating about tobacco. But I'm going to start before I even get into that. I want to inform and let people get to know me. I'm the type person that enjoy helping others because in this lifetime, we all will need a helping hand. And when I can help someone, that makes my day. Because my daily goal is to try to help at least 2 people. And each day I work on reaching that goal because I never know when I have to have my hand out.
All right. I hear that, Miss Annette. Thank you so much for sharing that. And, Howard, hope you don't mind, Howard,
Yeah, man, please, name basis.
Great, please. All right. Feel free to call me Stan the Man or Stan. But seriously, tell the folks who might not know you, a little bit, saying like, where you from and just your interest, things of that nature.
Yeah, well, I'm Erie County Legislator Howard Johnson. I'm the legislator in the 1st District, and I represent primarily the east side of Buffalo. I share that on the county with our chairwoman of the legislature, Chairwoman April Baskins, and we are primarily the representatives on the county level for the east side of Buffalo. I'm a lifelong Buffalo resident, born and raised in Buffalo, and interestingly, the district that I serve is the district that I grew up in. So all these, all parts of the east side, particularly in the Ellicott and parts of Maston is where I grew up at, I serve. So it's like, being in the district is always like being at home because, I'm from the district. I know a lot of residents in the district and things of that like. So I'm Buffalo born and raised and, just happy to be here today.
You know what? Thank you for sharing that. Just to follow up on that, in terms of your role, like what motivated you to, run for office? Was there, like you said, you're from the community. Was there anyone that inspired you as well?
Well, you know what? I started out volunteering. When I got into politics, I got in on a volunteer level, helping others campaign. One of the first campaigns I worked on was Dr. Curtis Haynes, who was a professor at Buff State. He was the sitting Ellicott District Council member at the time, and he was up for a seat to be retained. He had been appointed to the seat, and he was running to retain the seat. So that was one of the first campaigns I was brought in on. It was a losing campaign, but that's what got the juices flowing, which got me involved and connected me with some great people. I'm part of the organization I'm with, Unity Coalition. That kind of got me involved and got my interest piqued about the elective office placement process.
Great, thank you.
Oh, I was about to say, you know what? That's actually how you and I met. Was working through politics, and we both know that it's not an easy arena to be in, but it's worth it.
No, it's not.
It's
Absolutely.
worth it once you get to the government. Once you're able to sit there and affect the change that you want to see. I would say that for anybody listening, though, can you tell them a little bit about how you at the county level have an impact in community health?
And that's a great question. The impact that the county has is when you think of what the county does, they are the biggest health and human service providers in Erie County. When you think city government, they are streets, parking, snow plowing, things of that nature. And when you think about the county's perspective, and when you think about I'll start with COVID. It was the county that responded to it. It was the county that got the PPE gear. It was the county that opened up the testing sites and things of that nature. So, the county is the big, they are solely responsible for the, health outcomes within Erie County. And so for that, I serve on those committees. And, when those things are being rolled out, they come over to the legislature for approval, whether it's for funding or, and mostly it's for funding. And I'll stop right there and say it's mostly for funding, though, when they do come over. So we on the legislators level, we release the funding that was allocated to these outreaches.
Yeah, absolutely. Thanks for bringing that up. And now I want to bring it over to Miss Annette. How do you do the work that you do? How do you impact community health?
Wow. With that, Reach was a perfect fit for me. Normally, I'm out in the community educating about cancer. I do have my own organization called We Are As One. And what we do is focusing on the ladies of our community to make sure they get their mammograms to avoid, the early detection of cancer is best. So when I heard about Reach, that just ties right into it with the tobacco. So educating people in regards to things that can, help you along in preventing or have that education to make you make better decisions. So basically, when I'm out there with Reach, I have a passion to let them know the damage that tobacco can and will do to your body.
That is beautiful. Thank you. And I just appreciated the opportunity to sit here and listen to how Howard impacts community health, how Ms. Annette impacts community health. And it's really important both at the community level, the very grassroots, talking to people at events, and then Howard's position where, you know, the allocation of funds is everything, because we could talk to everybody all we want, but if we don't have the resources to help them out with what they need, you know, it's really not really going to go anywhere. So with that said, I would really love to hear a little bit more about how the two of you met and what got the juices flowing to start working together. And we can start with Miss Annette.
Okay. Well, Howard and I, we attend the same church, Bethesda World Harvest National Church, right there on Main Street in Utica. With Reed, we started working together about last year. It's been about a year or so. But on other projects, we worked together in the past. And I really enjoy working with Howard because he's a very sincere person. And he believes in being there for the community. And one thing, he's a man of his word. And that's the type of a person that for those people out there that don't have a voice in the community, he's the perfect person to get our voice and our thoughts and our feelings out there in the community. So each and every time I have that opportunity to work with Howard, I like to jump, because I know it's going to be done right. People will know this is the person that we need to have our voice, because he really do care.
Yeah,
well, that's unsolicited testimony right there. I didn't even have to pay for that one. Yeah, it's always a pleasure working with Annette. I like the collaboration we got. I'm a supporter of her as one events that she does annually. So I'm a big supporter of that. And I think it's worthwhile when you have groups and individuals that's doing things that impacts community. Those are the things that we need to support. Yes, supporting Black clubs are great. Supporting, kids events are great. But when we have, community outreach that's going to impact the community, that can change the trajectory of our community, I think we have to be front line. So that's one of the things when I took office that I wanted to do, to be able to help those groups who are impacting communities and, that's starting out on the grassroots level, but could use that little extra push.
Great. I don't know if that was having feedback. Can y'all hear me?
Yeah,
yes.
Okay, great.
Fine.
All right. Howard, can you talk a little bit about, I know that you're a big supporter of REACH, and Annette and the Tobacco Action Group team, in terms of their tobacco efforts. Can you talk a little bit about why that's important to you, and maybe how it maybe impacted you or your constituents, your community?
And yes, that's another great question. So it's important to me because the outcomes. When 2019, there was a report that the governor released about cancer cluster on the east side of Buffalo, and it was a ton of zip codes. But for me, what was impactful was 14211, 14215. 14225, and there were 6 types of cancers that this report talked about. It was lung cancer, prostate cancer, esophageal cancer, colorectal, oral, and kidney cancers that affects those particular zip codes. So, when I first took the seat, that was the first relevant piece of information I saw. Once I was appointed, this report came right out, and it was like, wow. And I held a town hall at the William and Emsley Y, and we talked about these cancer clusters and things that we could do, the educational aspect and lifestyle change that we could create to help, those in those communities. And it wasn't well received. The community was very honest because of some of the conditions of the homes, the water, the lead, paint in the homes, and things of that nature. And lifestyle led to some of these outcomes. So it's been on my heart, been on my mind to always support any efforts that would change behavior patterns and change outcomes in our community as it relates to cancer.
Thank you for that.
Yeah, absolutely. And you touched on a point that when we look at those cancer clusters and those zip codes, and look at it from a lens of how it relates to tobacco, when used as intended, will kill you. Okay?
Absolutely.
And as a result of that, I want to lean in on tobacco a little bit. The tobacco industry, and I'm talking about, not ceremonial or traditional tobacco. I'm talking about commercial tobacco. Okay, let's be real clear and specific. The tobacco industry has said that they're targeting our youth as the next generation of replacement smokers. So you as a youth award recipient, what are your thoughts? How do you feel about that?
You know what? We've seen it for years. You've seen it in television commercials. You see it as you travel to some of these stores. You see it. It's an intentionally targeted in minority communities. When you stop at a store, I remember as a kid they would have Newport, Cool, Virginia Slim, the advertising right there. So, that's right. Just always intentional. So it's something that's subliminal that resonates in your subconscious for, quite some time. So if you've seen your parents smoke, it was something that was probably passed on generationally. They probably seen their parents smoke. Then you've seen your parents smoke, and then your kids see you smoke. So these are things that's passed down. And I know I'm speaking for me because I've seen that in my family. My grandmother smoked. My mother and father smoked. And my sister smoked, but me I have another brother and a sister. We kind of tried to break that curse right there and say, you know what, we're not going to be the ones that partake in tobacco. And we recognize that it's the how it's ingrained in us and how it's ingrained in our community that's the biggest obstacle we face.
Yeah. The tobacco industry has normalized tobacco use and has intentionally targeted, communities of color to the point where, as you pointed out, over 85% of African Americans not only smoke tobacco, but they smoke menthol tobacco in particular. And 45,000 die each year as a result of that. And, you may have heard that, there's a movement taking place across the country, New York State as well, and here in the city of Buffalo, to remove menthol, tobacco from the shelves. I just wanted to see, what are your thoughts about that, as it relates to, your constituents and your community?
I think that's a great first important step, and we have to get those in our community to buy into those corner stores. When you look at Tops and Wegmans, who don't sell tobacco products anymore, taking them off the shelves, we have to have that same concerted effort in our communities, with our stores and those who provide those smoking products, to get rid of those menthol products which are much more so addictive than the actual other tobacco products, because it lessens the taste of the bad tobacco. It actually kind of jazzes it up and sweetens it up and gives it a cooler feeling.
Yeah, absolutely. I think we all remember the Cool Jazz Festival, that our parents used to go to down in Cincinnati. Yes. Look, our parents used to go to, but that's how they infiltrate our community with, with advertisement, with discounts, with, the promotion of activities and events that we enjoy to make it seem pleasurable and a part of our culture, when it's absolutely not. It's harming, and when used as intended, will kill you. So I want to bring Samantha and Annette back into the conversation. So, we don't want to dominate, the mic. So we're going to share the mic, Sam.
But I do have a question for Stan. With the tobacco companies, there is a saying, I think I read it somewhere, but I know the saying. What is it that they say in their board meetings about the tobacco that they're making money off of us, and who do they make those products for?
Yes, as a result of the master settlement agreement, all of the tobacco industry board meetings and documents, their minutes are public information, or FOIA, so to speak. People they can apply to see what they said. And one of the things that the tobacco industry said in their meetings was that they were asked, do you smoke? You smoke tobacco? And one of the executives said, we don't smoke it. We reserve that right for the young, the Black, the poor, and the stupid. That's in their documents. That's their words. That's how they feel about, communities of color, how our youth, about our youth, and their actions are intentional. So when I'm able to sit and have a conversation with and work side by side, shoulder to shoulder with, you, Annette, and also the Honorable Legislator Howard Johnson, someone who can put pen to paper to impact change, to create a different norm, a different narrative, I get excited about that, as well as Samantha as well. So thank you for that question. Very excellent question.
So in other words, we're actually paying them to help kill us. Is that what we're doing?
Well, essentially, let me put it this way: what other business or company intentionally kills its customers?
Okay. Thank you for that. I needed to, enlighten myself as well as the listeners to that fact.
Yeah, absolutely. I think there's a snake, that eats this. I'm gonna stop right there. Once a snake, always a snake. Let me just leave it at that. So go ahead, Sam. I see you leaning in.
And next week on Reach Radio, Annette interviews Stan. So this is pretty good. So other than flipping the script and becoming an interviewer, Miss Annette, what kind of activities do you participate in with Reach to get this information out about tobacco and the harm that it causes?
Well, with Reach Tag Team, we go out in the highways and the byways. Right now, we're doing a lot of our focusing on the East Ferry Corridor. But what we do, we just get out there, and these facts that Stan and I were just discussing, people need to know that. So we get out, we do our tabling, we go to a number of different business. Stan, how many businesses do we have right now that has understood our mission and signed policies?
We have over 40 minority, and I want my add minority businesses.
Yes.
And WBEs and MBEs that have signed tobacco policies.
So basically, they see what our mission is, and they see the passion that we have on trying to, save lives in the community. So we go out and we talk to them, we educate, we do the tabling, and we sign those policies state. And we're not saying that we're against smokers. What we're saying is we're trying to get the menthol, because the menthol is the one that does the most damage to our bodies and get us addicted. So we don't ever want anybody to say, well, Reach is against smokers. No, we're definitely not against smokers. We're just out here trying to save their lives.
I appreciate that. And with that, sometimes it can be really hard being out there tabling on this kind of stuff, because you'll talk to one person and then get 15 others that have no interest in talking to you, right? That's how it goes when you're out there in the community. But do tell us about tell us a win that you might have. We want to hear a success story.
Basically, my success story, I have a lot of them, but to be able to be on one quarter and have 40 business schools, churches, to actually see what we're all about and actually sign policies that saying that they want their area to be smoke free. We even deal with multi-unit housing. That's a hard one. But once we see that they're adapting to it and they're saying, well, yes, I live here too. We have a few smokers, but we live here too. And we want our area and where we live to be smoke free. Because what a lot of people don't understand, the secondhand and the third hand smoke. I've never smoked a day in my life, but I ended up with cancer, and basically I was always around people that smoked. My sister, she never smoked a day in her life. She ended up with 3 bouts of cancer. So, my thing is, I just need to educate people in regards to, you don't have to put the cigarette to your mouth, but once someone around you put that cigarette to their mouth, it's doing just as much damage to you as if you're smoking yourself.
No, I appreciate that. And so for those who might want help on quitting smoking, what's something that can do? What's a resource that they have?
What we do when we're out in the community, we're talking to you and we're informing them about the New York State smoke quit line, and in order for them to, get assistance, because there is people out there, we do know smoking is an addiction. It's not an easy habit to kick. So basically, we inform them of the quit line. It's 1-866 New York Quit. For those of you that's like me that don't want to, figure out the lettering, the number is 1-866-978487. That's 1-866-697-8487. And it is the New York State Quit line. And they're more than happy to help in any way to help you kick that habit.
I think, Annette, thank you so much, for pointing out once again that, reach isn't about, it's not against smokers. We recognize, that, tobacco use is an addictive product as well. It's hard to quit. Howard mentioned that, how it's easier to inhale and digest, and, things of that nature. And that's why menthol, is so impactful, and one of the reasons it's addictive, and it's menthol in particular is harder to quit as opposed to non-mentholated, tobacco products. So thank you for, raising that point. I was just wondering, like reach has several components, not just tobacco. We're working in also increasing access to food and nutrition, improving community clinical linkages, how healthcare providers communicate with us, with their patients, that's very important. We're addressing diabetes, we're addressing high blood pressure, those correlated risk factors. And I was just wondering, Howard, is there anything surrounding health overall, any initiatives that you want to highlight that we haven't had a chance to discuss, you haven't had a chance to speak about?
Absolutely. I know our chairwoman, and I was a co-sponsor with her on the Office of Health Equity to help to address the health equity disparities that exist in our minority community. So we've actually created a Office of Health, Office of Health Equity to look into those things, to the diabetes, to the mental health crises, the tobacco crisis, our cancer crisis, those things right there. Specifically place that in there to help our communities to better themselves in this area. So that's one of the things that we've taken upon on a county level to do to make sure we're helping to address some of these health disparities that exist in our communities.
Yeah, thank you. And for those of you who might not know, REACH is actually funded by the Center of Disease Control. And we're one of 31 grantees nationwide, who are, working, in these spaces. And I had a conversation last week, as a result, unfortunately, of the tragic, event that happened here in our city on, May 14th. Had a conversation with the branch officer for the REACH program. And one of the things that they expressed was that if there was anything that they can do to support the city of Buffalo and REACH in particular, that they were willing to do. And one of the areas that we uplifted in terms of expanding our focus areas is mental health. And I want to give a shout out to Samantha and some of the other community partners and other officials such as yourself, Howard, who might not be here right now. One of the reasons they were willing to do that is because we have a unique community mobilization engagement structure, whereas though we actually believe that it's the residents, the community, that has the answer.
Yes.
And we engage the community in an intentional way in that process, and not all grantees, do that from the REACH perspective. So that was highlighted and acknowledged, and it as a result of that, it provided our community with the opportunity as we move forward to work closer with you, Samantha, as well as the Office of Equity, in the days, weeks, months to come.
That's perfect. Yeah. And excitingly, I'm going to let folks know is that, I know outside of my office on Fillmore Street that we are a tobacco-free zone. We also took that challenge. You guys didn't, I forgot to mention that, but we also took that challenge to be a tobacco-free zone. So, I intentionally always look out the door, and if I see folks smoking, I say, hey, this is a tobacco-free zone. I'm not saying you can't smoke, but this side of the street right here is a tobacco-free zone, and a lot of folks respect it. They'll go their way and go do it somewhere else. So, we took that challenge as well. I think it's important to start with those small victories there, and we build them into larger victories.
Excellent point. You just reminded me because, Howard, when you did that, the fragrance stores, the right next door, they adopted a policy. The supermarket across the street adopted a policy. The cleaners that have been at Fillmore French for decades, when I had waves, adopted a policy.
Right.
So, it had that type of rippling effect. So thank you for your leadership, and thank you for being willing to stand in the gap with us through times of tragedy, and also turning tragedy into triumph as well.
Yes.
So, thank you, sir. I want to see Annette or Sam. Is there anything that you all would like to add before we close out our discussion, our conversation, our Reach Talk today?
Well, basically, when we're out in the community, I want to thank the people for taking the time to at least stop at our gate or ask questions. But if you guys need us to come into your schools, your churches, anywhere that is needed, so that we can continue educating. And again, I can't stress enough, Reach is not against smokers. We just want to continue saving your lives and educating you about the harmfulness of tobacco.
I like that approach. As I'm thinking about it, I like that approach right there, because a lot of times when folks think you're trying to take something from them, they are not. They don't want it. They don't really want to receive your messaging. So when you let them know that you're not against them and that you are, just, hey, we're here to help, to assist. That I think that's such an important point to know.
And then for me, I'm just really glad to have these conversations and then, spread the message about how important all of this work is, both at the governmental level and the things that we do on a grassroots level. It's all incredibly important. It hits near and dear to my heart, as I don't know if most people know this, but typically health outcomes in Native communities tend to mirror what's happening in Black communities. And definitely smoking had a big impact in my family. My mother and father passed away at 55 and 45 years old, and they had been smoking probably about half their lives.
Wow.
So it definitely had a huge impact in my life and in the Native community and a lot of other Native communities. So I just wanted to show that parallel, and thank you even from the bottom of my heart for the work that everyone here does.
Yeah, thank you, Sam, and thank you, everyone, for sharing your testimony, your story, and making yourself vulnerable. And I believe that your messages, have resonated with, some, if not all, of our listeners. And if you need help, assistance, to quit, once again, and you're in New York State, call the New York State Quit line, 1-866 NY Quits, or 1-866-697-8487. You might be eligible for some free nicotine replacement therapy, the patch, the lozenge, maybe even the gum. And depending upon your insurance or what have you, you can be eligible for additional coverage as well. So on that being said, I am Stan, the man Martin. I want to thank my co-host Samantha for joining us, and our lovely guest, Miss Annette, and Hojo, legislator, the Honorable Howard Johnson. And I would be remiss if I didn't mention our producer, Miss Angelita, behind the scenes, for making this all happen. So thank you very much. Stay safe. Have a blessed day.
Reach Buffalo, promoting a healthy community. Reach, racial and ethnic approaches to community health locally in Buffalo to reduce racial and ethnic health disparities and rates of chronic disease. We want to make a change by reducing exposure to tobacco in housing and work areas, by increasing access to nutritious foods, by creating a breastfeeding community, by increasing referrals to primary care and community health providers, and by implementing community work groups. Reach Buffalo will concentrate on Ferry Street itself, as well as the community that resides within 4 blocks to the north and south of the corridor in 5 zip code areas: 14208, 14209, 14211, 14213, and 14215 in Buffalo, New York, with disparities in rates of chronic disease. Get involved. Ferry area residents will have the opportunity to have a platform to voice their opinions, organize, and make decisions in these efforts. For more information, you can contact Ebony M. White, Community Outreach Coordinator.